The National Health Research Conference is a Ministry of Health-led research conference that is held every 2 years. It is a must-attend event for leaders, policymakers, change agents, health and development practitioners, scientists, researchers, and members of the public who have interest in health issues. The conference brought together about 600 delegates, including experts in the field of health and related disciplines within and outside our borders, to share scientific knowledge under the theme Research-Based Evidence for Improved Policy, Programming and Practice for Health. The delegates were welcomed by the Hoho Regional Administrator, His Royal Highness Prince Chegeti.
Almost soliloquizing, we hear God saying, "My people are dying for lack of knowledge." Knowledge, knowledge, knowledge can never be overemphasized. Your Excellency, the Prime Minister, and the House at large, the whole regional administration feels honored to have been chosen to host this very important conference, the National Health Research Conference, which has put all of us together in this fashion. It behooves me, therefore, to welcome all of you to this conference and to the region as we look at ways and means to strengthen the national health system of our country.
Dr. Kosim Tsetwa, the conference chairperson, outlined the conference objectives.
The National Health Research Strategic Plan is aligned to the National Development Strategy, which explicitly states that there should be specific research programs in all fields of major importance to help the country meet its development objectives. Therefore, in line with this call, the health sector is committed to invest in health research and disseminate the findings. Hence, the biennial National Health Research Conference, which started in 2010 with a variety of themes. The organizers of the conference appreciate with a lot of gratitude the support and guidance that we received from our Minister of Health, Minister of ICT, and all other development partners and people who supported in the preparations of the conference as well as holding the conference we are having today.
Dr. Ota Okechukwu, the World Health Organization Regional Director Representative, asked what investments need to be made by countries to strengthen health research systems.
The big question is, what investments should a country make to strengthen its national health research system in order to facilitate the generation and utilization of research evidence for improving policy, programming, and practice? I give you 6 points and I will close. 1, develop and strengthen national regulatory frameworks by legislating for health information as well as research systems, including ethical considerations and health technology assessment units to support the development of evidence generation. 2, invest in strengthening national health information systems to generate timely and good quality data and align this with national statistics bureaus and policies. 3, invest in national health research systems and institutes to set and execute public health research priorities to obtain context-specific knowledge for health system strengthening to meet the country's need. 4, establish and build capacity of an EVIPnet in the country to undertake the knowledge translation functions for the improvement of evidence uptake into policy and practice. 5, ensure adequate financing in line with the 2008 Bamako Ministerial Declaration by creating a budget line for health research commensurate with at least 2% of the national health expenditure and at least 5% of external aid for health projects and programs aimed at national health research system strengthening. Finally, mainstream the use of evidence in the formulation of policies, targets, and indicators addressing the SDGs and USC.
The United States Deputy Chief of Mission, Michael Lombardo, said the country might be the first to reach epidemic control of HIV.
This week's conference comes at a perfect time when Swaziland is in the global spotlight for its tremendous achievements in the fight against HIV. SHIMS2 results show that the rate of new infections in the country has decreased by 44% from 2011 to 2016. And because of this robust response, Swaziland might be the first country in the world to reach epidemic control of HIV. We should all commend those individuals, teams, and citizens who have helped Swaziland achieve such a milestone. But we know that the battle for an AIDS-free generation is only beginning. The National Health Research Conference is the ideal forum to marry theory with practice. These discussions between researchers, program managers, and policymakers will lead to better, healthier lives for the people of Swaziland. Through PEPFAR and its implementing partners, the U.S. government has worked steadily alongside the government of the Kingdom of Swaziland in its fight against HIV. We are currently providing programmatic support to ensure more Swazis are aware of their status, get treated as soon as possible, and are virally suppressed once on treatment. Through this conference, I urge policymakers and programmers in our midst to act quickly with the data from this conference to formulate real solutions to these urgent problems. With high-quality research data, resolute leadership, and policymaking, and innovative evidence-based programming, together we can ensure that all Swazi citizens will live longer and healthier lives.
The Deputy Prime Minister Paul Dlamini said the National Health Research Conference has brought together experts, policy leaders, health programmers, economists, and service providers to interrogate existing evidence and experiences on the importance of health research in improving the health system.
It is an event that is intended to strengthen the national research system, support the development skills, and the transfer of knowledge. It brings together two sectors, health and ICT, to value and use research as an essential element in providing information and guidance for policy formulation, planning, resources allocation, and intervention. As a country, we realized as long ago as 1972 that we needed a research coordinating mechanism, and this gave rise to the establishment of the National Research Council to set up research ethics, identify research priority areas, and operate as the umbrella body, monitoring research work in the country. This unit is now the National Research Science, Technology and Innovation Mechanism, housed under the Ministry of ICT. One outcome is the development of the partnership between the health and ICT sectors, with both working together for this year's conference. We are immensely grateful today to have international speakers and delegates with us at the conference to share their experiences in research.
Breakaway sessions were conducted, and these sessions highlighted new practice-changing studies with groundbreaking evidence. Various topics were interrogated and generated healthy debates with implications for the health sector. Other related activities included exhibitions and side events which contributed to an exceptional opportunity for professional development and networking. Service providers in the health sector displayed their wares, and judging from what was on display, there was no doubt that the country is well on its way to making Vision 2022 a reality. A gala dinner was hosted in the evening. The highlight being Dr. Nimrod Matekere being recognized for his contribution in the renal dialysis unit in the country. Lutsango were at hand to entertain the invited guests. Prizes were awarded to the top 3 oral presentations and top 3 poster presentations.
And the winner is quality assessment of various brands of nifedipine tablets obtained from various retail pharmacy outlets in Swaziland. Hlatla Hleko. And the winner is the title All Hands on the Deck Towards Ending TB Through Community-Based Case Finding in Swaziland, which is written by Joyce Sibanda.
Prizes were also awarded to the conference organizers for their hard work and dedication. The conference met its desired objective as alluded to by the conference chairperson.
Oh, I must say I'm very excited about how it has come out. It has developed. We're having a lot of very rich papers being presented. And the most exciting thing is that the majority of the papers are being presented by our own national professionals, the Swazis, and they're talking about things that are really happening in the country and recommending how we can improve going forward. The other thing I'm excited about is the attendance. We also have noticed that the majority of delegates are local, and they are taking this whole thing of a research conference very important. I've had a discussion with the representative of the regional director for WHO. He's just overwhelmed with the success and the way the whole thing has been organized. And of course, he's also excited about the theme, which can be copied and used even by other countries. That was his impression.
Okay, this year's conference was wonderful, because we had purposefully taken a decision that we need to be looking more into clinical aspects, where our theme has been to use research-based evidence for programming, policy, and practice. So we've seen a number of papers that are looking into clinical research, and it's been encouraging to see some of the students from our institutions presenting some of their research work they do as part of their undergraduate, and it has really opened our eyes and encouraged us. This research in the health sector has really developed, and we are very eager to see where we will get to, and very encouraged.
I would say that we are committed as government to foster research and development, but we will note that this is an area that needs a lot of investment, and I think holistically government will have to invest more in that. We are beginning to see avenues. You look at the Royal Science and Biotechnology Park coming up with very promising prospects. We look at SEPAC. If you look at their mandate, I think those are the government machineries which foster research and development in the country. What is lacking now is to make decisions, strong and strategic decisions in investing in research and development, as well as innovation. I think I am optimistic that in the next 2 to 3 years, we are going to see more and more investment in that area by government.
Health system strengthening, a journey towards policy research connection. This thematic area focuses on analyzing, engaging, and challenging power and politics in health systems research, health systems development, or learning strategies in relation to the broad conference theme of research-based evidence for improved policy, programming, and practice. Health systems research is a multidisciplinary field of scientific investigation that studies how social factors, financing systems, organizational structures and processes, health technologies, and personal behaviors affect access to health care, the quality and cost of health care, and ultimately health and well-being.